Well, every day we keep reporting increasing numbers of cases and deaths here in Michigan.
But what's the picture that those numbers are painting for us? What can we read into them? In other words, we bring in Dr. Frank McGeorge for more on that. Doc?
Yeah, Kim and Devin. So let me give you a little perspective. In documented cases, Michigan is currently 5th in the nation, and in deaths, we are currently 7th. So make no mistake, Michigan has been hit hard. And I say has been because the nearly vertical daily increase in case counts is frankly only limited by our testing capacity, which is running at full tilt. But the fact is, we have absolutely no idea where the top of those case counts are going to go yet.
Yeah, and we know you were on a conference call with the state updating the situation. Frank, how does it look in other parts of the state?
Well, that's important, Kim. So while there's definitely been more consistent spread in heavily populated areas, especially southeast Michigan, there are large areas of the state that have only been minimally affected. Right now, though, our area is the hardest hit, with many hospitals, frankly, pushing past their usual capacity.
Well, and
already.
if hospitals are already pushing their capacity, then how close do you think we are to seeing a shortage of hospital beds?
Yeah, all right. So I can only put this in some perspective. Here's where it stands now. One of the most sobering facts that I took away from the call was that as of last night, we have not successfully removed any COVID-19 patients from a ventilator. Now, some are hopefully on their way to recovery, but here's the deal. This is a zero-sum issue. Every patient that stays on a ventilator, then every new patient that needs a ventilator will eventually equal the total number of available ventilators. That is a problem. So I need to give everyone a serious reality check about how this is going. Right now, we are right in a position to care for everyone as we would have under normal circumstances. But we are rapidly approaching a point where that will not be possible. And that's when the hard decisions are going to have to be made about who gets limited supplies of ventilators and other types of care. And that is why the governor's order to stay home, stay safe, is absolutely what we need to be doing right now. You need to approach every single person that you have contact with as if they are carrying the virus. And I realize that is a really hard way to live, but that level of caution is actually what will help slow the spread of the virus and give us all the best opportunities to save as many lives as possible.
Yeah. So, right, you know, Doc, when I hear people talk about comparing it to flu season, we have a lot of people that get the flu every year. A lot of people die. We don't talk about hospitals running out of capacity when it's about the flu. We don't talk about doctors being afraid to see people who have the flu. It's different, right?
Yeah.
That is absolutely right. It's, you know, it's not just like a sense that it's different. It is actually different. During flu season, we definitely bump capacity on some days, but this is very different because these are long-term patients on ventilators that are not coming off. And as we get sicker patients coming in, again, it is going to be a zero-sum issue. We will run out of resources if we do not slow the curve. We need to slow down the influx of patients.
Absolutely. All right, Doc, more from you just ahead.
Indeed. All right. Well, when Governor